A recent study out of the Pew Research Center found that 70% of teens view anxiety and depression as a major problem among their peers. And now, New York State lawmakers are considering a measure that could allow children to take mental health days off from school. New York State Senator Brad Hoylman is now here with us. He is one of the sponsors of the bill. Senator, thank you so much for being here. We've been talking about this extensively as we look ahead to what is going to be Suicide Prevention Day tomorrow. But what would you say to the viewers about the bill and the new legislation as it is written?
Well, the bill, Alex, thanks for having me, follows suit among other states like Oregon and Minnesota that have instituted this type of new regulation, which allows students to claim a mental health day. It's important because we're seeing more and more young people thinking about suicide. Having mental illness as a condition is something that we cannot ever take unnoticed. And so by allowing schools to actually have mental health days for students, we think that this will raise awareness among school administrators, teachers, and families.
You know, you often hear adults joke like, man, I need a mental health day. But for you, this is something that's incredibly serious, and you think that maybe combats some issues that teens and other children are going through.
Absolutely. The rates of suicide ideation and suicide attempts and suicide contemplation and actually have increased significantly over the last 10 years. Self-harm has nearly doubled in emergency rooms and hospitals for teenagers, for example. So this new law would finally recognize that it's important to be physically well as mentally and behaviorally well. And that's what we think we can accomplish with this legislation.
I want to go into a little bit more detail, too, about the Pew study. We have some of the other issues that students outlined in this. In addition to depression and anxiety, teens also ranked bullying, drug addiction, poverty, teen pregnancy, and gangs when asked about their concerns in the Pew study. If the child is stressed or being bullied or worried about drug addiction or really any of these issues, do you think that the problem will be addressed with one day off of school? Does there need to be other programs that are married together to give these children the help that they need?
Certainly, that's a great point. But, you know, in politics and government, often you need to start with a new law that helps build evidence to make certain that we have those kinds of wraparound services. So by allowing students to take mental health days, we think that we will raise the level of services and begin that important conversation at the level of state government that we actually need more resources, more school psychologists and clinicians and physicians to examine this very important part of a student's well-being.
So will the state outline how many days students can take and what qualifies, or would you say that each school district then will be able to decide?
Well, it would be up to the State Department of Education to promulgate those regulations. As they do with physical health, it is often up to the local school board to make those decisions.
And what do you hope that these students will gain, knowing that they have the protection to take care of themselves?
Well, you know, Alex, no longer will a student have to lie about why they're staying home from school. And this conversation hopefully will be forced out in the open, not just with their teachers, but with their parents and their family members, too.
Do you worry at all that knowing that children will be taking mental health days will subject them to bullying?
Well, I think that that's a consideration that already exists, and that's why we're seeing greater amounts of self-harm, probably because of social media, and you know, our modern society can encourage that kind of interaction. But this is a safe harbor for students who may be undergoing that kind of threat in the school environment or at home.
And I think that we can all agree that we want our teens and our students to be safe and to have, you know, the mental health evaluations that they need and deserve to make sure that they take care of themselves. Thank you so much for being here. We appreciate it.
Thank you for having me.
Also, we reached out to the New York State Education Department for comment, but their spokesperson said that they don't comment on proposed legislation. We also reached out to the New York City Department of Education and are waiting for a response there as well. But if you or anyone that you know is considering harming themselves or they just want to talk, you can reach out to the National Suicide Prevention Line. We have this number for you now. It is 1-800-273-TALK or 1-800-273-8255.